Hello, Ryan. How are you doing today?
Good.
Good. So you're here for your wellness exam?
Yes.
Okay. So I am Michelle. I'm your nurse practitioner today. My nursing assistant did do your vital signs, which were normal. She did your eye exam, your Snellen chart, which was good. At that time, she also took a social history of you. She went through your allergies, which are no allergies at this time, correct?
Correct.
And also did a medical history, and at this time you have no complaints, but you do have a history of sleep apnea. Is that correct?
That is correct.
Okay. Well, we're first going to start, we're going to do a head to toe, and I'm going to start at the top of your head, and with that we're going to have you lean forward. Let me know at any time if you feel any pain. I'm looking for any lesions, bumps, bruises. Everything look okay? Any pain?
No.
Okay. Look at me. All right. So now I'm looking at your eyes. Everything facially is symmetric. You have all your hair on your eyebrows, your eyelashes. Can you look at me? Close your eyes. Open them wide. Lift your eyebrows. Okay. Oh, show me your teeth. Okay. Now open your jaw. Close your jaw. Okay. So we just looked at cranial nerves numbers 7 and 5. So now at this time I'm going to be checking just some different eye muscles. So I'm going to need you to look at me. And we're looking for strabismus. Okay, very good. Open your eyes wide. Okay. Okay, very good. And we're going to look at your pupils for indirect. Okay, and I'm going to do it one more time. Very good. That's good. So here's going to be direct. I'm going to do indirect. Very good. So at this time, I'm going to take my pen light and I'm going to move it towards your nose, and I want you to follow it at this time. I'm going to test for accommodation and convergence. Very good. So I'm going to take the pen light and I'm going to move it in all different directions, and I need you to follow it with your eyes only, okay? This is the cardinal fields of gaze. No, just your eyes.
Okay.
Okay, no nystagmus. Okay, so now we just did cranial nerves number 3, 4, and 6. I'm going to take a look at nice. Yeah, those look good. So now I am going to take a look at your ear. Take a look at the skin around. Any pain?
Nope.
Okay, if I had an otoscope at this time, I would take the pin out, look it up, put the otoscope in, turn it around, and look at the membrane inside. Okay, I'm gonna have you look straight ahead. And any pain with the palpation to your sinuses? What about at the maxilla? Any pain?
Nope.
What about down your nose?
Nope.
No? Okay, very good. Can you take and cover one of your nostrils? Can you breathe in and out? Any difficulty?
Nope.
What about your other one? Okay, very good. We're going to do that one more time. And I'm going to give you something to see if you can smell it and see if you can identify it. So again, can you cover one? Breathe. Okay, can you smell that?
Yep.
What's it smell like?
Kind of like peppermint?
Yep. Try your other one.
Yep.
Okay, very good. Okay. Okay, we're going to now take a look inside of your nose. So at this time, I want you to stick your tongue out and say ah.
Ah.
Tongue out. Ah.
Ah.
Okay, let me grab the pen light because that'll. Ah.
Ah.
All right, so we do have phonation. The uvula did move out midline. Tonsils that are grade 1 plus. While I'm in here, let me stick your tongue out. You don't have to say ah. Just look at the Google. Very good. Okay. And now you just open your jaw and close it. Okay. No clicking or feeling of TMJ. So now I would like you just to stick your tongue out. Stick it straight out. Move it side to side. Okay, very good. I'm going to now feel in front of your ears, behind your ears, and then just do some lymph nodes. Let me know at any time if you feel any pain. So I'm going to be Paraverticular, postauricular. Okay, submandibular, segmental. Okay, anterior cervical, posterior cervical. You can kind of put your head down a little bit. Okay, so occipital. No pain, tenderness.
No.
Okay, can you shrug your shoulders up for me, please? Okay, so not as high. Okay, very good. Yeah, yeah. No pain, tenderness. Okay. No. Again, push against my. Okay, very good. Looking at your neck, everything looks midline. So now I'm going to come behind you, and I'm going to just feel your thigh, right? Here, can you swallow for me, please? Very good. Swallow again. Very good. Okay, so if you can come move on this side of the exam table for me. And kind of boost yourself so that your back is exposed to me, so you don't have to get on the bed a little bit. And can you move forward and kind of just hug yourself? Okay. At this time, I'm going to be just looking at if your skin was exposed. I'd be looking at your skin, looking for any lesions, bumps, bruises. Everything looks symmetric. Do the spinal. Any pain, tenderness?
No.
What about on the ribs?
No.
Okay. Okay, take a deep breath. Okay, very good. So, can you say 99?
99.
Say it again.
99.
Say it again.
99.
Okay, I'm going to just check for CVA tenderness. So you might feel a little pounding on your back. Let me know if you feel anything. Okay. Or any pain.
No.
Is that okay? Is that okay?
All good.
All right. So now I'm going to just be tapping on your back. It's just going to be feeling to make sure that it's called percussion. So okay, very good. So now I'm going to just be listening to it. So during this time, I'm going to be probably asking you to take a couple deep breaths. Okay, deep breath. Deep breath. Deep breath. Deep breath. Okay. Deep breath. Okay. I'm going to have you at this time turn around and lay on the bed. I'm going to listen to some heart sounds. Any chest pain, difficulty breathing, shortness of breath?
No.
No? Okay. So I'm going to just listen to your valves right now. I'm going to start with the aortic valve. Okay. A minute. Oh no. With the tricuspid. And your mitral valve. Very good. I'm also looking at this time if there's any chest heaves, any palpitations. At this time, when I look at the neck, there is no distension on his neck. So I'm going to ask you to, if you can roll over onto your left side. I'm just going to take a listen to these valves again, just to see if there's any murmurs at all. Okay. I'm going to have you lay back down and we're going to start listening to your abdomen. Any stomach pain, any issues with the bathroom at all? You're able to have bowel movements and no pain or anything? Okay, very good. So at this time I would take a look at the abdomen, look at the skin, look for any scars. He denies that he's had any abdominal surgeries. So after the inspection, I will start listening to it, starting with the right lower quadrant. while I'm auscultating, I will listen to the arteries at this time with both sides of the stethoscope. So now we're gonna do a little percussion. And since I'm palpating all air, I'm not worried about an enlarged spleen. And then do a little light palpation. Let me know if there's any pain or tenderness at this time. Is that okay?
Okay.
Okay, I'm gonna go a little deeper this time, so let me know if it's uncomfortable or causes any pain.
Okay.
Okay, so at this time, I'm gonna try to come up under your rib cage and try to see if I can palpate the border, the bottom of your liver. So at this time, take a deep breath. Let out. I'm gonna have you try it one more time. Deep breath. No. Okay, very good. Any leg pain, any joint pain from your hip, knee, ankles? Okay. So with this leg, if you could lift it up, bring it out. Can you bring it over your body? Okay, very good. All right, bring it back down. All right, can you bend it at the knee? No problem. Okay, lift it up. No problem. Okay, I'm gonna just feel your hip bone. No
Good.
pain when I'm touching that. Okay, no pain at your knee? Behind your knee? Okay. What about at your ankle?
No.
Okay, on your foot?
No.
Okay, can you move your ankle around, up, down? Okay, can you move your toes? Okay. Extremities are warm. Good capillary refill. Good pedal pulse. And we got a posterior tibial pulse. Okay. Okay, so now do the lower extremity. I am going to have you sit up at the edge of the bed. I'm gonna have you sit. Okay, so now I'm just gonna listen because to your carotid, right? So straight ahead. Okay, I want you to hold your breath. Very good. Let it out. You can breathe. And then listen to the other side. Okay, hold your breath. There you go. Okay, so now we are going to be checking your neurosenses. So one of the things we're gonna check is that you can tell, sharp from soft, okay?
Okay.
So I'm gonna be close, or this is gonna be soft, and this is gonna be sharp, okay?
Okay.
So I'm gonna have you close your eyes, and then you're gonna tell me if you feel soft or sharp, okay?
Okay. Soft. Sharp. 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 Soft. Soft. Sharp.
Okay. I'm also gonna check your upper extremities at this time too. So just feel your shoulder. Okay. Elbow. Any pain with movement there?
No.
Okay. So at this time, feel your radial pulse. Very good. Good. Capillary refill. Very good. So if you can take your hands, put them in front. Okay, can you swing them behind you? I know it's really hard. How about back? Okay. Can you rotate your wrists back and forth? Do this with your elbows. No pain or tenderness?
Nope.
What about this with your fingers? Okay, very good. Okay, so I'm gonna have you close your eyes. I'm gonna put something in your hand. It's a common object. I'm gonna see if you can identify what it is. So I want you to feel that what's in your hand, and if you can tell me what it is.
Paperclip.
Yeah. Very good. That's sterigenosis, and then we're going to do graphesthesia. So I am going to write a number in your hand and let me know if you can tell me what number it is.
7.
Okay, very good. So now we're also going to test the kinesthesia, and I'm going to take your thumb and I'm going to have you close your eyes and I'm going to move it in certain directions. I want you to tell me up, down, right, or left, okay?
Up. Left. Down.
Very good. Okay. So the next thing I'm going to do is you're going to look at me and I'm going to have you touch your nose and then you're going to touch my finger, okay? So touch your nose. Touch your nose. Touch your nose. Touch your nose. Okay, very good. Next thing I want you to do on the top of your legs is this really fast, okay? Okay, we're testing your cerebral function. Okay, very good. Now if you can take your foot and rub the front of your shins on both sides. Very good. Very good. Okay, next thing I'm going to have you do is I'm going to have you stand up. Okay, come stand in front here. And I'm going to have you tandem walk. So that's going to be one foot in front of the other. So walk to the edge of the exam table. Okay, very good. Now turn around. Now if you can walk towards me on your tippy toes. Cracky toes. If you walk away from me on your heels. Okay, very good. Now come towards me, face towards me. Come up. You have to make sure we're in the, there we go. Now we're gonna do what they call the Romberg test. So I'm gonna have you close your eyes, stand in place, and we're just gonna make sure that you can keep standing up straight, not fall over. Okay, just some small wavering areas. And then at this time, I just want to make sure they can see you. Come back a little bit. Okay, we're going to just test some your strength of your spine. So at this time, can you do like trunk rotations?
Yep.
Okay. All right, very good. Now, can you bend backwards? Okay. Can you bend over and touch your feet? You are the only person I know that can do that. Okay. Okay, I think at this time then we're ready to do your reflexes, so if you would like to sit down. And we're going to test your upper reflexes, deep tendon reflexes, and your lower deep tendon reflexes. So with the reflexes, I'm going to have you, we're going to do your tricep first. Relax your arm. There we go. Now we're going to do your right bicep. So let's just have you rest that. Your brachial radius. Middle finger going there. Okay. Now we're going to do your patella. Great leg relaxed. Okay, we're good. And then I'm gonna do your Achilles tendon. There we go. Very good. All right. Thank you very much.